Well, good afternoon, everybody. My name is Francesco Galdo. I'm a consultant rheumatologist, and I lead the Raynaud and Scleroderma program in Leeds. And I've been asked by SRUK to share this time with you. I know that there have been many questions about what to do in these challenging times of COVID-19 for people that already have issues with their Raynaud and their scleroderma. And we thought instead of answering one by one, perhaps we can have a live session and see whether we could help. Well, just by announcing that we received many questions already, and some questions are similar, but there is not one exactly like the other one, because of course everybody is different. So I tried for now to just divide them in some categories, in some broad categories, and see whether we could give answer to your questions. But if you see that there is not, or if you have any specific question, this is the time to write them here, and I will be able to read them and reply in real time. So for the questions that I received, one question was say, "Hi, Dr. Galdo, I've been diagnosed for 15 years ago with severe Raynaud's and undifferentiated connective tissue disease. I am on nifedipine and sildenafil. I get often attacks. They can last days or weeks, and she tried many different drugs. What can she do?" It was not exactly a COVID-19 questions, but there you go. Here there are several treatments that can be tried, and these are in hospital settings. So I'm afraid in these times that we're trying to triage and having only the urgent cases admitted to hospital is not the best time to experiment new treatment. But as soon as this storm weather off, please do go back to us and we'll see whether we can help, above all before the winter time. Another question say, "Hi, I am shielding from government and consultant confirmed advice. The written published advice is not to leave the home for any, in capital sick, reason. Why, please? For my own mental well-being, I choose to minimize risk by exercising, by walking just before dark when there are at least people out and about, and pull up a mask in case I should feel vulnerable. Your comment, please." So this is a question indeed I've been asked also by my patients here. We have informed them directly, the one that needs to shield, and I understand this is a challenge. It's stressful, and as you write, is affecting your mental well-being. So why to shield? Why you cannot go out? First of all, that is true. Shielding means not to leave the house for any reason. And why is that? The reason is that there is only a very minimal risk that you may encounter the virus when you leave the house and you are by yourself. If somebody had just had a cough or a sneeze in the place you're walking by, or if you touch something that had been touched, you can get in contact with the virus. Now, I understand this is minimal risk, but if you're being told to shield by your consultant, is because in case you get in contact with the virus, you are at high risk of having severe pneumonia. And severe pneumonia in people that are on immunosuppressant, or in people that have lung disease, and I'm not sure why you've been advised to shield, can be a very bad news. We know that there is only a small proportion of people infected by this virus that develop pneumonia, and among those that develop pneumonia, there is a sizable proportion of people that need oxygen, and among these there is some that don't make it. One of the few things we know is that if your immune system has been challenged, if your lungs have been challenged, or if you have other risk factors, which are the ones that brought your consultant to tell you to shield, you are at risk of not making it. And that is why, although the risk of contacting this virus is very little, it's better safe than sorry, and you should shield. Hopefully, if everybody is following the advice of social distancing, this will not last very long. But if a consultant has confirmed you to shield, please do it. It's not just for the NHS, it's for your own good. Now, I have another question here. I'm not sure what to do. I have scleroderma and Crohn's, and I take methotrexate and social distancing and go for a short walk once a day, avoiding all other people. I have supermarket delivery once a week, and my daughter gets anything else I need, leaving me on ramp outside the front door. Is this okay? Am I okay to go out for a walk? Okay, so this is another situation. You don't know whether to shield or not. Oh, I see messages coming through here. Let me answer this question first. So, if you are taking one immunosuppressive drug, there is a precise risk assessment that you should follow to see whether you should shield or not. For what you write here, you're taking just methotrexate. It's not enough for me to give you a complete advice. SRUK has published some guidance on their social media, and they're going to do it again at the end of this session, because methotrexate is one of the immunosuppressive drugs. And if that's the only thing, then no, you don't have to shield. But if you have any other risk factor, and this includes lung involvement, include diabetes, hypertension, include taking something else together with methotrexate, includes kidney disease. So you might either have a strict social distancing or proper shielding. So please refer to that guidelines so you can see whether among people taking immunosuppressant you have any other risk factor. Now I see here people joining. Melanie, hi Melanie, and Melanie writes, I am on extremely vulnerable list. Is it okay for family I live with to go out and shopping, etc., as long as they social distance? Also, should I cancel ibuprofen infusion? That's a very good question. So, Melanie, yes, people that are around you, they should be extremely careful in what they do. If they are the ones going for a walk or going for shopping, they should avoid any contact, any direct contact with you, above all when they come back, if they don't clean completely themselves. And as far as your iloprost infusion, this is actually answering a few other questions that we received. So iloprost is important. In this time of the year, some people can spare a couple of weeks, 3 or 4 or 5 weeks of iloprost. If you're not in extreme need of iloprost, I would defer it for a few weeks. So the risk of going out and contacting the virus, if you are extremely vulnerable, is slightly higher than the benefit that iloprost can give you to prevent disease, above all if you stay in the warmth of your house. I hope that answered the question. Liz, Ali, surely you employed as a responsibility to help you to shield yourself. Claire, hi. Will the normal blood monitoring be taking place? Hi, Claire. Thank you for joining here. So, yes, actually, the question from Claire was a question that many others asked. What happens? I'm on immunosuppressive drugs, and to have my repeat prescription, I need to check bloods. What should I do? So, in this case, get in contact with your consultant. In your case, it's me. And what do we do? If you are on 3 monthly blood monitoring because of mycophenolate or because of methotrexate, or you are a monthly blood monitor because of bosentan, we have been following a triaging according to how vulnerable you are. So if you are vulnerable and you need to shield at any cost, I've been going back and check whether you had any sign of toxicity for mycophenolate in the past 2 or 3 times. And if not, I've been okay to reissue a prescription for a few more weeks. The same is for bosentan. If you're not extremely vulnerable and you can go to have your blood test, then it's in this case, it's safe to go to the safest place to have blood tests and check for monitoring. But we have not been extremely strict to the day or to the week. So the common answer is, if you have to shield and you had no sign of toxicity before, we can continue for a few weeks and we monitor it. If you don't have to shield, then yes, go ahead and have your blood test where you can. Now, Chris O'Hara. Hi, Chris. Thank you for joining. He's asking, if one of us is unfortunate to get symptoms, at what point should we contact? Oh, how do I scroll up here? Sorry, this is the first time for me too. At what point should we contact? So, unfortunately, this happened already, and some of our patients have contracted symptoms. So, what to do? First of all, if you're taking immunosuppressive drugs, if you are on the vulnerable list, if you develop any symptom of COVID-19, you call 999. And you call 999 and you say that you're vulnerable, and you say that you contracted these symptoms, and they will admit you. At that point, they will contact your consultant. For the leads patient, they contact me, and you will follow the same route. I've been giving some minimal insights into how to manage COVID-19 infection. The immunosuppressant drug will be stopped, and you can stop it right away before anybody tells you. If you have these symptoms, like we do for any other chest infection, you stop it. And then don't worry of contacting me directly. Call 999. Don't worry of contacting your consultant. Call 999. Be admitted and stay safe. Maria Dawson. Hi, Maria. Hi, Dr. Del Galdo. Great to see you. Thank you for all this. Thank you. Thank you. It's great that people find it helpful. I understand this is stressful for many, and it's stressful for us too. We work week after week to try to optimize how we manage Raynaud and scleroderma, and then a storm like this comes and threatens to throw away all the hard work we're doing. But as our queen says, we'll find better days. We'll see again. We're going through this, and there is first signs that we're already going through that. Now, let me see some more questions here. Liz Price. Thank you, Dr. Galdo. I have limited scleroderma and Graves' disease and Addison, but consider my scleroderma relatively mild, no internal issue. Had a letter today, but I'm assuming I'm less at risk. How do we more widespread? This is correct. Yes, so thank you for this question. There are a few other questions I printed already, very similar. So yes, I have scleroderma. Some people have limited scleroderma, they have diffuse, but they have no lung involvement, and they are taking no immunosuppressive. Do I have to shield? You need to understand that because of the diagnosis of scleroderma, you might receive a letter for shielding, because it's very hard for the NHS staff to go into the exact detail of everybody. If your diagnosis was recorded, they are taking the approach of better safe than sorry and shield. Truth is, if you have the diagnosis of scleroderma while you're not taking any immunosuppressive and you do not have a reduced lung function, you are not adding higher risk than other people. And this is exactly the same for people with Raynaud's. They have Raynaud's phenomenon, and as severe as the Raynaud can be, if there is no lung involvement, if they are taking no immunosuppressive, or if they don't have any other comorbidity, there is no increased risk. The only exception applies by age. If you're older than 70 years of age, that is a risk factor to begin with. So, but it's not because of your Raynaud's, it's because of the general population. And again, I see popping up more questions here. I appreciate this info. Thank you. You're very welcome. I hope this helps. No problem. Let's see. Siri, it's replying to you too. And thank you for replying to Diane. You're replying to yourself. Okay. I receive a letter like so many. Stuart Thomas. I receive a letter like so many and have been told to stay at home for 12 weeks. What happens after 12 weeks given a treatment for COVID-19 is unlikely to be developed? It's a very hard question to answer. 12 weeks was a deadline that the NHS decided to put for shielding, because we were expecting in 12 weeks for the most of this to weather off. Truth is, we are still within these 12 weeks. And the 12 weeks from the end of March will be April, May, and June, by the end of June. It's only by half June they will be able to tell whether shielding must continue or not. If we learn from the country that was most affected, which is the one I was born with in Italy, it looks like that 4 to 6 weeks after the deaths start to go up, things might peak and weather off. So we will know. We will know from countries that have been affected before UK whether 12 weeks is a reasonable timeline. But for now, I'll not be able to answer that question. Lauren Harvey. My mom works on the front line, but her boss isn't understanding that we both need to isolate as she doesn't have the appropriate PPE. That's very sad. I have systemic scleroderma on 75 milligram of azathioprine and 35 of losartan. I also have chronic asthma. I have letters from Royal, but they're ignoring it. What do we need to do? Okay, so shielding applies to you, and the people in your family should isolate as well. Now, the best thing in this case, it is hard. It is hard to have one rule that applies to all, but it is to discuss with the employer and have your consultant write directly to them, your doctor write directly to them and say, what can we do to prevent this situation to escalate? So if your mother would be allowed to isolate, or it's your mother works on the front line, that would be best for you. On the other side, your mother is giving such an amazing effort to help others, so it is a very fine line. You're living together, and it's a hard decision to take. If your mother is exposed to the virus and you need to shield, then I'm afraid the solution is that your mother should not work. On the other side, I see that you take only azathioprine. If you do not have any lung involvement, if you do not have any other risk factor, you shouldn't shield. So please go back to that flowchart that SRUK has published. There's also an instructional video that drives you steps to step, and see whether, besides that azathioprine, you have any other risk factor. If you do, then it's a matter of having a conversation with your mom and with her employer. Paula Manning is taking a course of steroids in the last year for polymyositis. The reason why should it be higher risk than the risk assessment shows? My occupational health department seems to think so. So yes, steroids is one of the drugs that are considered immunosuppressant and that are the first step in this risk assessment. If you've been taking 20 milligrams of steroids for 3 or 4 weeks, you should shield. If you're taking less than that, then there are other risk factors you need to consider, which you don't write here, so you can go back to that. But steroids for 20 milligrams for 5 to 4 weeks, and I'm referring to the official guidelines, they do require shielding. Susanna, hi. Thank you so much for this information. What level of lung fibrosis will make you significantly more at risk? That's a very important question. Obviously, lung fibrosis is common in patients with scleroderma, but the extent of disease varies a lot between people. You're very right. Is there a threshold that would be classed as much higher risk? Thank you. Okay, that is a clever and hard question to answer. Lung fibrosis is true. If you look just by CT scan and you have a small element of lung fibrosis, you are diagnosed with lung fibrosis. There is a threshold that led your consultant to decide whether to put you on immunosuppressant or not. And this is usually whether the lung fibrosis is less than 10% of your lungs or more, or some people say 20. But if, because of your lung fibrosis, you are on immunosuppressant, that you should shield. If you have a diagnosis of of mild ILD for which they decided not to put you on any immunosuppressant because it's very minimal or because it's been stable for years, then I would suggest to apply strictly social distancing if you do not have any other risk factor. But see, this is one of the cases where if I was your doctor, I would go and check with you and look what is most appropriate with you. It's very hard to make one rule for many. But in general, if you are on immunosuppressant because of that, it means that that is severe enough that you should shield. If not, chances are you might not have to. Melanie Body, when shielding, should family shower when they come back in from shopping? How much do you need to social distance in your own home? Yes. When you're shielding and the other family is coming back, they should shower, as you say. And for people that are in family, this is easier to adopt because they love you and they understand that they expose you to risk. I had letters from people that are just sharing apartments, where people that live in rented accommodation and they have a room in a shared house and the other people don't care, and that is a lot more difficult. But yes, when people come back, they should absolutely get rid of any risk before getting in contact with you, and you should stay distant from them until they do. Paula Manning, on the front line, employers are not taking the risk of those at home into account when risk assessing staff, in my experience. You're right, we have been learning day by day what is the best for us. This morning I was in clinic and our own personal protecting equipment rules are changing by the week. Unfortunately, this is new for everybody and we are learning. I can just testify to the number of doctors and nurses that at the best of their ability are trying to apply rules and common sense and changing rules to try to minimize this. But we don't have the final answer and we will learn on the way. For now, we're trying to define part of the hospital that are cold, as we call, meaning without COVID-19 patients, part that are hot, but this is changing by the week. Lauren Harvey, thank you for responding. I was informed that the vaccine was going to be a live vaccine. I was told that as a scleroderma patient, I'm not allowed to have live vaccine. Does this make us more vulnerable in the future once this vaccine becomes more available? Okay, so there is a lot of research about vaccines, and there is one in Pittsburgh that it looks like it's a bit ahead of the others, and it is not a live vaccine. It's a very clever type of vaccine that uses a skin delivery, microneedle skin delivery, and these are not live viruses. So in that case, if that is the one to go ahead, you'll be perfectly safe to take it. This said, the live vaccine, some of the live vaccine are contraindicated if you are immunosuppressant. If you are not, then it's another story. But for the one that is being currently developed, it looks like it's good news. Everybody will be able to take it. Julie Baines, I have MS and systemic scleroderma. I am at high risk. Yes, Julie, you are, above all if you're taking immunosuppressive, and probably you are. So in this case, if you are at high risk, you should shield. And I don't know if you were here since the beginning, but shield means not to go out. And you need to distance from people in your home if they go out until they are perfectly safe to get in touch with you. And somebody suggested a shower. I had somebody suggesting a pressure washer. That's a bit too much, but absolutely you should shield. Sarah Haddock. Hi, I have missed this as just on. I have systemic sclerosis with no motility in my esophagus, slow movement in stomach, amongst other things, due not to having a fixed address. Right. Oh, yes, Sarah, I read your questions too. You just wrote it. And you didn't receive any letter and you currently work in a supermarket. So yes, probably you missed the first part, Sarah. First of all, I'm sorry that you feel lost not having received the letter. Having scleroderma per se does not put you at high risk unless you have either lung involvement or for which you are immunosuppressant, or you're taking immunosuppressant because of your skin, or you have pulmonary artery hypertension, or you are higher than 70 years of age, and since you work in a supermarket, probably you're not, or you have any other underlying condition. If none of these applies, or you have a bad esophagus, I feel for your esophagus, of course, I feel for your symptoms, but the half full cup says, no, this COVID-19 does not increase the risk. Your esophagus does not increase the risk of having a bad pneumonia for COVID-19. Thank you for working in the supermarket, I guess. On top of your issues, you've seen how people have been fully responsible a few weeks ago. Things are improving, but thank you for helping despite your condition. Thanks a lot. Lauren, I had the letters to say for isolation for 12 weeks and I am on extremely vulnerable. However, I haven't asked to shield. Is that right? So, not sure which letter you received, and there are different type of advice, isolation or shielding. Shielding applies to people that are at high risk of developing pneumonia, severe pneumonia in case of COVID-19 infection. And as I mentioned, SRUK will republish some very detailed guidelines so you can follow and see. The letters have been sent out to everybody, and as I mentioned, is a better safe than sorry approach, so there might be a bit of a rag letter. So please follow that video. You will see where do you fit. Or write back to SRUK. I'll be happy to answer with more details. Yeah. Chris, my wife has scleroderma and we live in the New Forest. We have both been self-isolating, not going out, getting food through online deliveries, etc. We have been doing this for 2-3 weeks now. The only time I go out is at 19 for a run in the forest. Lucky you. 3 times a week, running trails where I see no one. I was wondering about whether I'm putting her at risk. Bless you, Chris. No, you're not. No, you're not. If you meet nobody, you didn't tell me what kind of scleroderma your wife has. You didn't tell me whether there is lung involvement or immunosuppressive. But it looks like you live in a very isolated place. It sounds beautiful for how you write it. Thank you on her behalf and on behalf of all the patients with scleroderma, to all the spouses that are helping. You're doing a great job. Keep doing it. Christine Clove, I have CREST syndrome and emphysema. I take hydroxychloroquine. Am I at risk? Okay, so hydroxychloroquine is one of the few drugs that does not increase the risk of severe pneumonia. Emphysema might. So it depends how severe is your emphysema. So it is not just about the hydroxychloroquine, and I don't know why you take it, but your emphysema, yes, puts you at risk. So you should shield if your emphysema is causing a reduced lung function. Claire Lou, I have scleroderma, renal asthma, and antiphospholipid syndrome. I take Cercept. Cercept or mycophenolate is one of the drugs that increases the risk. And yes, you should follow the advice. If it is only Cercept and you're taking it because of your skin and it's no lung involvement, you should just have strict social distancing. If you have any other factor, reduced lung function or any other immunosuppressive or pulmonary artery hypertension, and they're all on that flowchart, then you should shield. Okay. Thank you, Jay Virdi. Thank you so much for your time. Here, Dr. Galdo, residents significantly reduced lung DLCO. I am in shielding isolation. Is there any way I can monitor, keep my DLCO stable over these 12 weeks? Am I able to go out our garden for fresh air? Yes. Go out to your garden for fresh air. Hi, Lucy. I see Lucy Septon say hi. I replied to your question in a minute. So yes, go out. There is no way you can keep your DLC. You can monitor your DLC over 12 weeks, but as you have, you learn. Lung function for scleroderma does not decline day by day or week by week. So 3 months is not a big deal. I don't know what treatment you're taking, but you're doing the right thing. Stay at home, go out on the garden, and be sure that people around you follow the guidelines to reduce risk of you being infected.